My name is Mildred. I'm a medical doctor here at Procare Hospital. So diabetes is a chronic medical condition that is characterized by an increased blood sugar in our body. Most times it goes on and it affects our kidneys, it could affect our hearts, it could affect our blood vessels and even our nerves. Okay. According to the World Health Organization, there are about 422 million people worldwide diagnosed with diabetes mellitus. And out of a majority of this number actually comes from middle and low income countries such as Nigeria. And also about 1.5 million people, 1.5 million deaths have been attributed to diabetes mellitus every year. So when we talk about diabetes, there are like a huge number, like so many various types of diabetes mellitus. Predominantly, we have the type 1 diabetes, the type 2 diabetes, and then there's also the gestational diabetes. Okay. So the most common one is actually the type 2 diabetes that affects mainly adults, usually above 45. But in recent times, we've been seeing like cases of type 2 diabetes happening in very young people, 28, 30, just less than 40. Give or take. Okay. And what happens in this type of diabetes is that your body isn't producing enough insulin. Insulin is what actually helps to control the sugar that we take. So your body is not producing enough insulin, or that your body actually is resistant to just the little insulin that is producing. Okay. So with that, you're not able to handle the much sugar in your body, and then it just keeps going high. So when we talk about diabetes, there are like various symptoms that you could have that probably will be pointed to diabetes mellitus. Okay. So if you notice that you're peeing more frequently, whether in the daytime or at night, you wake up frequently at night to pee. Okay. You notice that you're eating so much, you're drinking lots of water because you get thirsty more frequently, or you're losing weight, or generally you're just fatigued. Okay. So these are some of the symptoms that actually could give you a pointer to diabetes mellitus. Okay. And unfortunately, sometimes we actually don't even have symptoms of diabetes mellitus. And in that case, the diagnosis will be made when the person already has some complications. Okay. And that's when most times that's the first time people actually get diagnosis of the condition. Because sometimes we can't actually get the symptoms of the diabetes mellitus, it's not very important for us to know some of the risk factors that can actually predispose you to having diabetes mellitus. Okay. So usually older people, maybe more than 45 years old. Okay. These are like this, that's a risk factor for having diabetes mellitus. Okay. If you have a family history of diabetes mellitus, so if your mom or your dad or any of your siblings actually have diabetes mellitus, then there is that's a risk factor for having the condition. Okay. So someone that has high blood pressure. Okay. And also, maybe if you've been told that you have a high cholesterol level. Okay. If you're generally on a bigger side, these are risk factors that can actually predispose you to having, diabetes mellitus. Okay. So diabetes generally is actually not a death sentence. I mean, when people hear about diabetes, they're like, oh my God, what's my lifespan now and all that. It's actually very, treatable, is manageable. Okay. There are medications that we can actually use to treat and manage it. It could be oral medications, or it could be injectables like the insulin. Okay. And also there are lifestyle modifications that we can do for people that smoke. It's just advice for them to stop smoking. Then alcohol intake. Okay. You just cut down on alcohol intake and just maintain a healthy lifestyle, increasing your physical activity, eating balanced diet. Okay. These are just ways that you can actually try to mitigate the progression of the disease and even to prevent onset of the disease, okay, and also delay any kind of complications that could arise from having diabetes mellitus. So by and large, I'm very happy, and I'm also very proud to let the audience know that here at Procare Hospital, we have our specialists and also a team of medical professionals that are always available around the clock to help you to either make a diagnosis of the condition, to help answer any questions, and to generally manage the condition anytime. Thank you.